Very good evening, friends. Meeting again in the session of Mater Medica. And we are discussing regarding the remedy, acute remedy, but having a in-depth action is Belladonna. It is a polycrest acting on many organs, but pace is very acute, very sudden. So symptoms appear suddenly, disappear suddenly, and producing a typical congestive stage of inflammation, a marked congestive stage of inflammation. So it is the remedy which comes at the third place. If you take into consideration the inflammatory stages, the first remedy, inflammatory stage of congestion before localization takes place is aconite, where pain is the big manifestation. Second comes the perampos, where the turn inflammation is developing, where the little bit pinkish appearance comes over there. And then the wholly blown congestion, which you can find it out in the belladonna. So any pathology where acute inflammatory stage and congestion is more marked, this is the wonderful remedy to be think of and utilized. So one has to understand this remedy from its action. Certain aspects and few cases we have discussed in the last lecture. We have discussed the constitution of a belladonna, how they are fair looking, they are generally having a blue eyes, then the fine complexion, delicate skin, looks like a phosphorus skin, all those things which we have discussed. And generally, these are the women or children who used to suffer more commonly over there. And second important thing, one important modality or one important generality which we have discussed, there is tendency, great liability to take cold, sensitive to drops of air, especially when uncovering the head, and from having haircut, tonsils become inflamed, very easily associated with the whenever there is a draft of air. All those things which we have discussed generally related with the belladonna. So belladonna patient comes to you in acute phase, and you should be able to watch belladonna state. I will share one case. It has happened nearly about around 2000. This case was around in 2000 when at midnight there was bill rang, and I observed the patients who came in panic. There are 3 4 persons who are coming along with small child over there, 3 year child, and they were in a panic state. That child had a fever since evening, and this fever started increasing. He was not my patient actually. The one of their nearby neighbors who were my patient. So they considered what to do in this at this time. So they directly took the patient and came to me. And this fellow, this child, 3 years child, male child, was in very high grade fever when I observed, and he was became very violent. He was shrieking and grinding the teeth in front of me, and they told me, doctor, what has happened? He slept, and he went around 1 o'clock. He got his sleep got disturbed, and he started behaving in a weird manner. He was shrieking, then he was just spitting. He wanted to bite us, and all of a sudden, this as we were getting frightened. What has happened? We have tried to keep the cold water on his head, but nothing worked, and he was just running here and there inside the house, trying to escape, go out. And ultimately, we have disturbed the neighbor's sleep, asked them what to do, where to go, and he said, we'll go to our doctor, and we have brought him to you. And when I was looking, he was looking like this to me, and he was just like grinding his teeth at me. There was a history of convulsion 1 years before during fever, and they were frightened that he might get the convulsion. That was the thing with him. When I have checked, his head was absolutely hot, but the extremities little bit comparatively much cold as compared to the head. And face was absolutely flushed red, reddish face was there. So I checked the pulse. It was full bounding pulse, very fast. And this child was in a panic state. So I asked, "Oh, what about the thirst, whether he has taken the water or not?" They said since evening he never have a single glass of water, not at all. We are trying, but he refuses. That was another thing which was very marked. So what I have done, I put just a Belladonna 200, one drop directly in his mouth, because that basically that was the only medicine, that was the medicine available in only potency 200 at that time at my house. So I have given Belladonna 200, one dose, asked them to wait over there in the OPD, and they sat down over there. And I have checked him after 5 to 10 minutes. Again, I have repeated one more dose of Belladonna, and then he became gradually calm. Then his grinding stopped. Then his staring looks came down. And he was just looking normally thereafter. That was a very important thing. His looks became normal. That he has opened the clear eyes and he was looking, and then he was started little bit crying, weeping. But the shrieking was completely stopped. His violent action stopped. The running away, escaping, all those things settled. And then I asked, let you go, no problem. Now there is nothing to worry. One more dose, repeat after 15 minutes and bring him tomorrow morning. And at 10 o'clock, they came for the just to show him. And he slept very good later after the third dose. And whole night he was sleeping. In the morning, he has little bit perspiration on the head. And when he was brought at 10 o'clock, he was as if the thing has happened. This is the acute phase of belladonna. The acute phase of belladonna, if you are able to catch, then it is quite easy to get the results very early in belladonna. And that's why we have to understand this remedy up to depth. I think we have finished the paragraph of great liability to take care of it. Let us go with the next paragraph on page number 58 in my book, Allen's Keynotes. Quick sensation and motion. I snap and move quickly. So there was this is one more thing. The I snaps quickly. This is very typical, which you can find it out. Even during the fever, this state is quite common. The pains come suddenly, last indefinitely, and cease suddenly, like McFoss. This is a very important thing. Pains are acute variety. And those are very typically pulsating, throbbing type of pains in belladonna. Because it is congestive type of problem. So McFoss is also, McFoss, it is more of neuralgic. In belladonna, it is more of throbbing, pulsating. So we have to differentiate the minute things between the remedies. Both of them are acute. Both of them are having the same pace. But belladonna, the flushed face is very characteristic. The redness, the hot head, very typical over there in belladonna. So you can catch belladonna very easily as compared to the McFoss. Pains usually in short headaches cause the redness of face and eyes. See, it is written in bold, and that has meaning. It means this is always a state of belladonna, the redness of face and eye, the fullness of head and throbbing of carotids, which is visible. You can see the carotids are throbbing, and you can look toward the child, just turn his face to one side, and you can see these carotids are just throbbing over there. You can watch them. See, this is one more thing. This happens generally during the fever. Fever state is very characteristic of belladonna. Imagine she sees the ghost, the hideous faces, and various insects. It looks very close to stramonium. Stramonium is also having similar fears. Stramonium is also having such a delirious state which you get used to get in the belladonna. So they are very close to each other, but belladonna, it is more of a violent nature. Violent mania is associated with belladonna as compared to the stramonium. Black, he sees the black animals, dogs, owls, etc. And these are the things, these are fears, generally common fears of children. These are very common features of children and fears of children. Belladonna, it happens in acute states. Whenever fever is there, it always comes in the state of delirium. But in case of Calcarea cup, the similar type, Calcarea is complementary to Belladonna. And in Calcarea, these phobias are there. Children, they fears the ghost, they fears the hideous places, the horrible things affects them profoundly. You get the Calcarea more marked over there. But in Calcarea, it is the constitutional symptom. In case of Belladonna, it is the symptom during the state of disorder. So if the fear is there, that is during if the fever is there during the state of fear, it is more characteristic of a belladonna in acute state. So that is a delirious state. Fears imaginary things, wants to run away from them, hallucinations. These are very, very typical of a belladonna. This is the manic state of belladonna, the delirious state of belladonna. And you can get these hallucinations, the fears, all typical during that specific time. Violent delirium. See what is it explaining? Violent delirium. Very typical, very, very violent. Disposition to bite, spit, strike and tear the thing. That is one more important thing. They want to tear the things. They just tries to tear the thing. They wants to break the things. Even during the fever, they go so violent. They never understand what is going on, and they throws away the things, whatever is there in their hand. Even sometimes they throws away the mobiles during that manic attack. Panic attack, very typical. Breaks into fits of laughter and gnashes the teeth. Gnashes the meat, that is grinding of teeth. Just pressing teeth one on one another. During specifically fever states, this is very characteristic with belladonna. Another remedy is tremonium. In Sina, generally it happens during the sleep more commonly, grinding of teeth. So these are things one should not forget. Wants to bite and strike the attendants. Very important thing. They want to bite and strike the attendants. They never cares or they never fears, in fact, for such a thing. They never cares who is there. And they start biting, they start striking. This is very, very typical of this remedy. So see, whole story revolves around the fever or during delirious states. It is more common. In general, belladonna is very happy-go-lucky. But when he goes into the delirious state, it is very dangerous. Tries to escape like Helleborus. Tries to escape, never wants to remain. He wants to go away. Go away from the situation. Go away from the doctor's cabin. Go away from the home. Never wants to remain in one place. That is very typical with the belladonnas. So this state you have to be very watchful. If you are able to catch this state, just give belladonna 200, 1 m, even 1 m you can give, with better potency to be utilized because it works very fast. See now, head is hot, painful, flushed face, eyes are wild, staring, pupils are dilated, pulse is full and bounding, globular like buckshot, striking the finger, mucous membranes of the mouth are dry, stools are tardy, and urine is suppressed. Sleepy but cannot sleep like chamomile and opium. This is the state of the child. Generally, whenever the fever is there, more commonly, whenever the fever is there, this state should be there. It is not just a fever and thirstlessness, you give the belladonna. It's not like that. Belladonna, you can watch that face is flushed, absolutely red, congested, head is hot, the eyes are sunken, pupils are staring, dilated. The pulse you can watch, just take the pulse and it is full bounding, very important feature, and a violent delirious state. So whole concept which you have to understand, this is the state of the belladonna child, specifically during the fever state. So fever never comes just as a fever. Fever is associated with all those things. Then it is a belladonna fever. Then what is it? Convulsions during teething with fever, very, very, very important feature of this remedy, very important. During the teething period, the fever comes and there is a convulsion. Pyrexia with convulsion, first remedy to be think of is the belladonna, always, always. Without fever during dentition, if convulsion is there, it is McFoss. Yes, it is McFoss. So teething is a teething period where there is a irritation of gums and gingivitis happens, and because of that inflammatory state, fever happens over there. Think of the belladonna. If it is going towards the convulsion, belladonna. Second important thing which you can catch over there, fever associated after the haircut, very commonly in children. They cries a lot and they goes into the same belladonna state. The fever happens to be there associated with the flushed face and everything. So these are very, very essential things which you have to be very watchful. Convulsions come on suddenly, head is hot, feet are cold. Convulsion, it is very acute. Nothing was there, and all of a sudden the fever comes and convulsion comes. Very suddenly, it happens to be there. Patients attendance gets panic because this is generally happens to be there in children, not in elders commonly. And that's why you should be able to catch all those things. Rush of blood to the head and face, like amyl nitrate, the glonine, the melilotus, all congestive headache remedies, all of three. The congestion is very marked. Same is true with the belladonna. Belladonna also has similar type of congestion, very severe congestion. The head becomes so painful, throbbing, as if it will going to burst. And you can watch one important thing, always see the face of the belladonna child. It is absolutely red, flushed. Second thing, don't miss taking the pulse. Pulse is very important. You can catch the pulse, full bounding pulse. That is second important thing. And just look towards the carotids. Carotids are very, very important. You can just watch. You don't have to palpate. Nothing. Very easily you can catch. Yes, carotids are throbbing. This is belladonna. So you should not miss these things. And then he explains the headache of belladonna. What he says belladonna? Belladonna headache is congestive type of headache with red face, the throbbing of brain and carotids like melilotus, aggravated by slightest noise, the jar, the motion, the light, lying down, least exertion. And these are all modalities very specifically because it is so congestive. Slightest movement aggravates, slightest noise aggravate. They cannot tolerate the noise during headache. It is very specifically during headache. It is not all the time. It is not like a sensitivity of asaram or theridion, where the sound penetrates to their ear and it enters inside body. It is not like that. This sensitivity or this aggravation is specifically whenever there is headache or fever. Jar, slightest jerk, not possible to remain over there. Slightest motion aggravates, light aggravates, lying down aggravates. Headache aggravated by lying down, a headache aggravated by least exertion, little bit exertion, there is a headache. See, these are the things one must understand. It is ameliorated by pressure, look like a bryonia. But bryonia, it is not throbbing like a belladonna. It is not throbbing, pulsating like a belladonna. There is no congestive phase. Bryonia, it is generally inflammatory, which where the sinuses gets congested over there with mucus and frontal sinusitis, and which is better by pressure over there. Here it is better by pressure, but it is not like bryonia. Bryonia, it is more stitching. In case of belladonna, it is more throbbing, pulsating. Tight bandaging ameliorates. And this is very typical with both bryonias as well as the belladonnas. But belladonna, it is very acute. Wrapping up, that is also another thing where they feels better. And lastly, they feel better during menses. Why? Because bleeding is there. Because of bleeding, the congestion becomes less and person feel better. That is very typical physiological modality, that whenever there is menses appears, the headache stops, because this is secondary to the congestion. Congestion becomes less because of it, and that's why the headache stops over there. So see, headache is very, very typical characteristic, and this is associated with red face, the throbbing of brain, and carotids. These are three important words one should not forget. The modalities one should not forget. One more feature which is very close to the APs, like Helleborus, like podophyllum, there is a meningeal irritation which happens to be there, and because of which these children used to bore the head into below the pillow. This is very typical with them. Because of that, they goes away from the light. That is one thing. Because of keeping the pillow over the head, the noises becomes less, and because of which they feel little bit better. That is the reason in APs it is because of hydrocephalus. Same is true with Helleborus. But in Helleborus, it is hydrocephalus associated with meningitis, associated with maybe with encephalitis. Whole pathology you can find it out with Helleborus. So acute pathology, brain pathology, you can get over there in Helleborus. The vertigo when stooping, looking down, vertigo aggravates. Or when rising from stooping, bryonia. Very here it is close. Acute is Belladonna, subacute is bryonia. Even in inflammatory stages, you must catch action of Belladonna 1 to 7 days, bryonia 9 to 20 days. The difference is there. The subacute action you can catch with the bryonia, whereas acute state you can catch with belladonna. Even though they are look similar, it is not so similar. You should be able to ask, if patient says, doctor, all of a sudden vertigo has started since yesterday, associated with headache, with throbbing, with feverish state, then it is more commonly with belladonna. But if it is persistent for 4 5 days, and there is a congestion in the forehead, and there is stitching type of pain is there, then there is thirst, more thirst in case of this belladonna, bryonia, absence of thirst in belladonna. These are very important things which one has to understand. These differences gives you exactly the right remedy. So you should be able to understand these differences and the states, the acuteness belladonna, subacuteness bryonia. This is basic difference between these two remedies. So even though vertigo is very close to it, there is a difference. Vertigo on every change of position, every change of position. If he turns towards left, there vertigo is there. If he turns toward the right, vertigo is there. If he walks, the vertigo is there. But all this is associated with the congestion of the head. It is related with the head congestion and flushed face, the redness of face, the throbbing carotid, associated with the feverish state, associated with thirstlessness, then that vertigo has a meaning. It is not just pure vertigo like bryonia. It is not like that. Conium. Conium here it is pathology generally. Conium vertigo is a positional vertigo generally during the in the bed position, turning the head from side to side or turning the position in bed aggravate the vertigo is conium maculatum. But generally, conium is the psychosyphilitic remedy where you get the pathology behind that. Might be there, might be anything, tumor or etc. Those are very common with the conium. Abdomen. We'll see the abdomen. Abdomen is tender. It is distended, aggravated by leash jar. See, this modality is common modality which is applicable everywhere. So least jar aggravates, whether it is headache, whether it is pain in abdomen, even least jar, even of a bed, obliged to walk when with great care for the fear of jar. He cannot tolerate any jerk. Slightest jerk aggravates the pain in abdomen. It is so sensitive because it is abdominal inflammatory state. You're going to find it out over there. The pain in right ileocecal region, that is the appendicitis, more commonly, or typhlitis. Typhlitis is inflammation of a cecum. So pain in right ileocecal region aggravated by slightest touch and even of the bed cover. Slightest touch aggravates. Modality related with the acute inflammatory states. Cannot tolerate you. They will not allow you to touch. That much sensitivity is marked with the belladonna. So you are not able to examine the patient because it is so painful, so troublesome. And modality that tells you directly the slightest jerk causes them a trouble. And last sentence, which we will going to learn in today's session, is the transverse colon protrudes like a pad. It is the transverse colons which comes on frontal side, inflammation of the transverse colon, acute inflammatory state, colitis, acute inflammatory. It is not chronic. It is not ulcerative chronic colitis of a chronic nature. No, not at all. It is acute state, acute inflammatory, where the transverse colons just comes in outside. It is protruding like that because it is so painful. Acute colitis, think of belladonna. If there is throbbing, think of belladonna more commonly. So this is a wonderful remedy. One has to understand its aspects regarding each and everything. So we'll stop over here and tomorrow we'll finish this remedy because remedy relationship of belladonna one has to understand. That I want to share with you the practical approach of belladonna. If you are able to treat the patient with belladonna, how to go ahead. And that's what we're going to learn in tomorrow's session. Till that period, thank you being there. If any queries are there, we can have a chat. Otherwise, we'll conclude. So we'll meet tomorrow at the same time regarding it. If any query related with belladonna, you can ask. So thank you and good night to everyone. Yes, Dr. Vijaya.
Good night, sir.
Okay.
Good evening, sir.
Good evening.
Sir, what is the difference between belladonna and aconite? Both are sudden, acute.
You were
How
not
to
there
dose
for
it?
you were not there for acute, I think. Aconite, I have discussed. I will going to tell you just now, but my suggestion is go with the aconite videos because aconite is absolutely different state where inflammation is not settled. The sentence is very important in aconite. Open the Allen's notes. What he says for the congestive stage of inflammation before localization takes place means you are not able to watch the congestion inside the anywhere. It is very typical with the aconite. But with the belladonna, you can able to watch that congestion. In aconite, pain is the characteristic and it is very severe type of pain. Patient goes into the very much agony, tossing in bed and he is coming to you with fear of death and in a panic state. He never comes gradually. He comes, doctor, please do something. He's in very acute panic state. But you see, nothing is there, no congestion, nothing. Belladonna, you can see the congestion. So when belladonna state is the third state. First is aconite, second is parampos, and third is the belladonna. So this one has to understand.
Okay, sir. Thank you, sir.
And my suggestion, go through the aconite video, then you will clearly differentiate the belladonna from aconite.
Okay, sir.
Thank you and good night.